Dental Office Emergency Case Study Project, Anaphylactic Shock by Alice Araújo. Patient is scheduled for 2 quadrants of scaling root planing. The hygienist delivers local anesthetic to upper and lower right quadrants prior to treatment. Within 5 minutes, the patient experiences anaphylactic shock. Ms. Days is scheduled for scaling and root planing in the upper and lower left quadrants today. Medical history was reviewed and no allergies to any medication was reported. Vitals were taken and they were within normal limits. The patient agrees to receive anesthesia and the hygienist proceed with injections on the upper and lower left quadrants. 5 minutes later, Daisy starts to show redness and urticaria throughout the body. She also shows dyspnea, wheezing, and angioedema of the eyes, lips, and larynx. Daisy is having an anaphylactic shock. The hygienist immediately calls 911 and administers epinephrine intramuscularly, making sure she holds the device in place for 10 seconds to ensure complete delivery and massage the injection site for 10 seconds to facilitate absorption. While waiting for the EMS, the clinician administers oxygen at a rate of 4 to 6 liters per minute, monitor vital signs, and watch out for the recurrence of the symptoms called biphasic anaphylaxis. Anaphylactic shock means the opposite of prophylaxis, which is immunologic protection. This is the most severe form of allergy because this can cause swelling of the larynx that can ultimately obstruct the airways. This is considered a type 1 reaction or immediate hypersensitivity. This is also characterized by sudden onset and rapid progression. The quicker the reaction, the more life-threatening the symptoms can be. For this specific type of allergy, the severity depends on the amount of allergen exposure, rate of exposure, and route of exposure. The sequence of vascular events in anaphylactic shock begins with the release of histamine by the body. Then the blood vessels dilate and leak plasma. After that, the blood pressure falls, leading to impaired venous return to the heart. Because of this, the cardiac output becomes inadequate and circulation drastically is reduced. This is a list of common allergens that can lead to anaphylactic shock. We have here dust, pollen, foods such as peanuts, tree nuts, shellfish, milk, eggs, and wheat, insect stings, and medications such as aspirin, nonsteroidal anti-inflammatory drugs, penicillin, and radiographic contrast media. We also have a list of the common allergens found in the dental office, which includes latex gloves, glutens, pine nuts that is found in some fluoride varnishes, sodium bisulfite, which is used as a preservative in some local anesthetic, and also ester type topical anesthetics. The signs and symptoms of severe allergic reaction include systemic redness, systemic pruritus, which is itching, systemic urticaria or hives, severe hypotension, dyspnea, angioedema of the eyes, lips, or larynx. And you also can see circulatory symptoms which can be life-threatening, which is hypotension, tachycardia, and arrhythmias. For the treatment, we should remove the allergen agent, call EMS, and inject epinephrine intramuscularly. For this, we should hold the device in place for 10 seconds to secure the complete delivery of the drug and massage the injection site for 10 seconds to facilitate absorption. If it doesn't work, we should repeat the epinephrine dose after 5 minutes, not exceeding the maximum dose of 3 injections. We also should place the patient in a supine position with the legs elevated. Administer oxygen at 4 to 6 liters per minute. Monitor the vital signs and monitor the patient in case the symptoms reoccur. That is called biphasic anaphylaxis. To prevent an anaphylactic shock, we should avoid contact with the allergen. We should also review the medical history with the patient, look for any allergies. If the patient knows that they experience severe allergic reaction, they can carry an epinephrine auto-injector with them at all times. We can also have allergy tests done, such as skin prick, skin scratch, and the radio allergos for